Hello, my name is Marian. In today's presentation, we are going to talk about MRI safety. In this presentation, we are going to talk briefly about MRI, obtaining thorough medical and surgical history about the patient, and having a positive or negative impact on the patient experience. We are also going to discuss the history behind MRI, a little bit about how the machine operates, and the importance behind proper screening and patient safety. And we also going to have a better understanding of about how important it is to ask the patient about their surgical history to avoid accidents or burns whenever they are inside of the MRI scan room. We have our educational objectives. At the conclusion of this presentation, you should be able to know the history behind MRI, understand that the MRI scanner is always on, share the importance of MRI screening to avoid accidents or burns to patients and other staff members, identify objects that cannot go inside the MRI scan room, use this as a refresher course for seasoned and experienced technologists, and use this as a learning course for entry-level MRI techs or radiology students that is interested in cross-training into MRI. So for the schedule, we're going to talk about the history behind MRI, how the machine operates, what you need to know about your MRI scan, what not to bring inside the MRI room, the importance of safety inside the MRI room, the current issues and concerns in MRI, how accidents are occurring in MRI, the importance of MRI education, ways to prevent accidents and burns from occurring, and we're going to talk about just key takeaways from this presentation. Before I begin, I always just like to ask if you all can feel free to comment below whenever you are done watching a video or in between. Just leave it in the comment section. What profession are you working in? Are you a seasoned MRI tech just getting more information or just want to watch the presentation? Are you looking to cross-train into MRI? You may be an MRI student or you may be an X-ray tech, CT tech, or another technologist in radiology looking to cross-train. You are an entry-level MRI tech that just got finished with your school. You are a nurse just obtaining more information. You could be a doctor just wanting to watch the presentation, or you just here because you just wanted more knowledge. This presentation, you will not get any CEUs from it, but you will get knowledge. Basic overview of MRI. This is going to talk about the history behind MRI and the contraindications for it. I'm not going to spend a lot of time talking about MRI. This is just going to be a basic overview just to get to the MRI safety part. For the history behind MRI, you have Dr. Raymond, who proposed an MRI body scanner in 1969. Dr. Raymond discovered the possibility of how to distinguish cancer cells in healthy tissue with MRI, and in 1977, he completed the first MRI scanner. So what is MRI? It's pretty much a non-invasive imaging technology that creates three-dimensional images of our body. It can be used to detect certain diseases and it can diagnose certain tumors, such as rheumatoid inflammation, if you have any sprains, infection, if you have spine injuries from sports or from a car accident. And it can also be used to produce images inside of our body by using a powerful magnet. That's why we always provide patients with earplugs and or headphones to help block out the sound so that it would not damage their hearing. And even if we leave for the day, the MRI techs, the machine is still on because the magnet is always on. So even though we will power down the computer, the MRI machine is always on. So what is MRI used for? MRI does not use any type of ionizing radiation, but it does use a powerful magnet. That's why we make sure no metal is going inside of the room or that a patient does not take an electronic device inside of the room that can get destroyed or that can burn them. But whenever it is used, it's easier to see the brain, spinal cord, your muscles, ligaments, and tendons. And in comparison with CT, it is often used to image the knee, ankle, foot, spine, brain, and shoulder. So, are there any risks of having an MRI? Since the MRI is a powerful machine, we want to make sure that we avoid any type of metal objects, making sure that patients do not take anything that's electronic inside because that can malfunction or it can cause burns, injuries, or artifacts. And if we do have artifacts on the image, it's going to make it hard for the radiologist to make a proper diagnosis. Whenever we are talking about risk and contraindications, we're talking about those electronic implants that cannot enter inside of the room unless the patient provide an implant card to determine if it can go inside the room or not. And you also have patients who are pregnant. They can have an MRI scan, but they cannot have it with contrast. And if they do need it with contrast, the ordering physician may have to reach out to the radiologist, or the radiologist may or may not okay contrast depending on what is being diagnosed, the patient's stage in their pregnancy, such as their trimester. And whenever you do have patients that come in for an MRI, sometimes they may experience claustrophobia. So it's better for them to have sedatives so that they do not get anxious or delay their imaging result. So they should reach out to their physician to talk about medication. Some things that you need to know about your scan is your primary care doctor or your ER doctor may order an MRI if your X-ray, CT scan, or imaging report returns back abnormal. And depending on the type of MRI scan, you have to be NPO, especially for those abdomen, such as those MRCP exams, at least 4 hours, or this may depend on the facility's protocol. You may need MRI contrast to help see the abnormalities and pathology better on the images. You do have to lie on the table for about 20 to 60 minutes, depending on if it is with or without contrast, or depending on how the facility have their MRI sequences and protocols set up. So holding still for the patient is very important to avoid motion and having to repeat the scan. So you want to make sure that you are relaying those instructions to the patient to hold still. For this information, a scheduling department or maybe the ordering physician may tell the patient about their MRI scan so that they can be better prepared. They want to make sure they arrive at least 15 to 20 minutes early to start working on their paperwork. If they do come at their scan time, it's going to make other patients late, so they should be aware to come early so that they can start filling out their paperwork. Whenever they do, they want to be detailed whenever they are filling out the MRI questionnaire so that they can put any surgeries, implants, so that we can know if it's safe or not safe for them to go inside of the room. After the patient does complete the paperwork, the MRI tech should go back over it with them. They should go back through each question just to make sure the patient understood it, the patient answered it correctly. I wouldn't go by the patient's answer, just verify that they did mean to mark or select something, because there was a time a patient put they did not have hearing aids, but they did. So you always want to make sure that the patient is filling out the questions correctly. Whenever they do come, you want to make sure that you change them into the MRI clinic or hospital gown or scrubs, just to make sure they have removed anything and everything from their pockets and that they have material on that is safe for them to have the MRI scan. So for the MRI scan, what you can't bring inside, you must remove these items listed: your glasses, your watches and phones, hairpins, wigs, and hair extensions containing metal clips or metal fiber threads. You want to make sure that you do not have your hearing aids or ear pods. A lot of times I feel like people forget to ask patients, especially if they are young, if they have anything in their ear. So just make sure the patient does not have hearing aids or ear pods. And also, younger people can have hearing aids as well. So always double check that. Glucose monitors. You want to make sure that patients remove this. I've had patients tell me a lot, maybe all the time, that the last tech, you will hear this a lot, the last tech did not make me remove this. But sometimes patients get a CT scan and an MRI scan confused. So maybe the last tech didn't tell them because maybe they had a CT scan, or maybe they had another scan where it was okay for them to keep the monitor on. But just make sure you're removing the glucose monitor or telling the patient to remove it. Credit cards, wallets, and change, make sure they remove that. Remove metal dentures. Remove anything that can come off, especially if it is metal. So whenever you are scanning a patient who has a pacemaker, I know at the hospital I work at, a cardiologist must sign off on the patient's form stating that they can have the MRI scan, and they will fill out the manufacturer information, the pulse, they will fill out everything on the form to state that the patient can have the MRI scan. At my job, we have a nurse that comes down or comes in to monitor the patient while we are performing the scan. And whenever we do, we monitor their vital signs during the scan. You want to make sure that you are always scanning in normal mode. I know some techs or sometimes techs may put the machine in first level mode, but if you do that, just make sure if you are scanning a pacemaker, it is in normal mode. I'm not going to tell anyone how to scan, so that's on you, but I normally scan in normal mode. That's the only scan I scan in. Yes, I see first level come up, but I have the machine in normal mode. If it does not let me do a certain scan, I just go back in and adjust some parameters so that I can keep scanning in normal mode to avoid scanning in first level. So whenever you are done with setting the pacemaker or a representative will come out and set the pacemaker, you want to make sure that it is in the correct mode after the scan. Do not let the patient leave the facility without putting it back inside the correct mode, especially if it's one of those devices that has to be reprogrammed after the scan. Whenever you are scanning a patient with the stimulator, you always want to verify their surgical history and implants. If a patient does have a stimulator implanted, the patient must bring their remote controller and it has to be fully charged. You do not want the patient to put their stimulator inside MRI mode at 4% and then it dies whenever they are inside of the MRI machine, and now their device is going to malfunction and it's no telling what can happen to the patient. So always just make sure that they know to bring the remote controller and that it is fully charged. And also watch your patient program the stimulator into MRI scan mode. There was one time I had a patient who tried to program their pacemaker or try to program their stimulator, sorry. They tried to program their stimulator into MRI scan mode and it wouldn't go into the mode. But I told the patient, I have to watch you do this. You cannot do it on your own. I have to see you do it. So the stimulator would not go into MRI scan mode, so the patient had to reschedule. And we also had to reach out to the company just to see how long it has been since the patient had that stimulator and if there's something they need to do to get it reprogrammed or maybe surgically removed and then put back in. So that facility handled that information with the patient. You also want to make sure to check to see if the stimulator can be scanned. Sometimes, depending on how long it's been or the leads, that the stimulator cannot go into MRI safe mode. So if it can't, do not force it. Always just reschedule the patient. It's for their safety. We know that it's going to be an inconvenience, but at least the patient will be safe. And you want to make sure you're verifying that stimulator implant with their card and that the device guidelines for the MRI conditional and safety concerns is up to date and is accurate. The implant card. So the MRI conditional or MRI safe implant card will have the type of surgery that was performed. For an example, I had a patient that had a device and the patient did not have a cord and I couldn't do the scan. And that was because the patient had some type of electronic device in and we didn't know what kind. The patient may have known what kind of device it was, but I need that card to confirm that is what the patient has. So always check the card because there was a time, I have a lot of stories. So there was a time where a patient thought they had a loop recorder implanted, but it was actually a pacemaker. So sometimes patients do not know what they have. They may get confused or they didn't understand what the doctor told them they had. So that's why it's good to verify that information with the patient and their implant card. For the adverse event report, this is from 2008 and 2017 by the Joint Commission, and there was about 1,500 adverse event reported. So the reports that got the most percentage was thermal injuries. So that's 59%. 11% is mechanical events, 9% projectile events, and 6% you have the acoustic events. So you just want to make sure that you are checking your patient, especially if you work at a hospital. Make sure they do not have that device on their finger that can monitor their pulse rate or their heart rate. So you always want to make sure that you are removing any leads and any device around their finger. And if you do have to monitor someone, make sure you use the MRI safe vital sign equipment. All right, in this section, let's talk about patient safety. We're going to talk about the importance of MRI safety, knowing your medicine, and verifying any patient allergies and MRI safe items and zones. The importance of MRI safety. This is going to be to prevent accidents or death from occurring to patients or staff members, to educate new and old medical personnel, patients, and visitors, to enhance the patient's experience and gain trust, to reduce claustrophobia fears, to send high quality diagnostic images to the radiologist for the best treatment and planning for the patient. You want to make sure that you know your medication, know the trade name, the generic form for it. Just know how it could be asked or how it will look if a patient come in and is allergic. You want to make sure that you are keeping the patient safe, especially if they're allergic to the MRI contrast. Whenever you are screening your patient, you know they have contrast orders. So ask the patient at that moment, do you have any allergies? Your doctor ordered this scan with contrast. Have you had an MRI scan done before with MRI contrast? If they say yes, ask them if they had a reaction to it. And also know different names for it, such as if you know that the MRI contrast we give is called Dotarum or Clariscan, you also need to know that the doctor or nurse may put in their allergy history that the patient had a reaction to gadolinium. So just know different names and different forms of how contrast can be asked. At my facility, whenever a patient is having an MRI scan done, this form is given to them. It's going to go over Dotarum, what they should know about it, any side effects, allergic reactions to it. And you also want to make sure that the patient is drinking plenty of water after they have the scan so that they can flush the contrast out of their kidneys in their body. Make sure you are knowing your patient and knowing the exam you are performing. This is very important about patient safety. I know a lot of times people think or texting patient safety means making sure the patient does not go inside the room with metal. That is true, but you also need to make sure that you have the correct patient. That is patient safety. That is important too. So make sure that you verify that you have the correct patient. You want to check the order, make sure you are performing the right exam, such as if you know a patient is coming in for headaches, but the order states the patient is coming in for their right foot, that should be a red flag right there. You want to check with the patient to verify which exam is being done. If you work in a hospital or if you work at a clinic that has wristbands, check the patient's wristband along with their order and the name as well. Select the correct patient on the MRI scanner. This is very important because you may have the correct patient, but you may select the wrong patient to be scanned. Therefore, the incorrect patient is going to receive the wrong results, wrong surgery, or treatment. So make sure that you have the correct patient and the correct patient selected on the MRI scanner. Are there any issues with MRI? So safety concerns are still a problem, even with me recording this video or presentation in 2024. There has been about 3 or 4 accidents that has occurred between June and September. This month I'm recording this is in October. It's just too many to keep adding to the presentation. It's delaying me from putting this presentation out. So there are still issues and safety concerns. I do have a few copies on the later slides in this video, but everyone must remain educated and aware. You want to make sure that you are paying attention to the MRI warning signs, paying attention to whoever is coming in and outside of the MRI suite or that tech area. You want to make sure that they are not bringing in any metal items, anything that should not go inside the room, to avoid those accidents and injuries. And a lot of times it could be due to lack of training and lack of education. So we have to make sure that everyone has the proper training and is educated. If you are an MRI tech or an MRI student, or maybe you just a nurse who have to come down with a family member or with a patient to the MRI scan, and maybe you're just a family member, you just came across this video and just watching to know more about MRIs, but get familiar with these important MRI signs. It will tell you stop, do not enter. The magnet is always on. Make sure that you do not have this before coming inside. So just pay attention to the signs. They're in red, so that should tell you alert or danger or pay attention to this information before you go past these doors or the sign. You have to understand your MRI safety labeling, especially if you are a new student who is trying to learn MRI. So MRI unsafe, you'll see that in red. These items should not enter inside the MRI scan room. Patients should not be scanned. MRI conditional. Items may safely enter the MRI room under certain conditions. So you want to make sure that you are checking that implant card, checking the SAR levels, the SAR limits, the static field strengths, the coil type, the machine restrictions. Make sure that you are checking this information. You are going to have someone, a patient, or maybe even a tech, to say the patient has already gotten scanned before. Okay, but what core did they use? What body part was being scanned? So you can't always go by the patient was scanned before, because if their head was scanned or brain was scanned, which core was used? Which machine? So now their abdomen or their foot is getting scanned. This is a different core. Is it safe or is it MRI conditional? So always just make sure that you are not skipping this step. You also have your MRI safe. These items can be placed anywhere in the MRI environment. No scanning restrictions. Where are the MRI caution signs found? These signs are found on the outside of the MRI scanner room door, on the outside of the MRI technologist work area, on the floor in front of the MRI room, and on different objects such as your wheelchairs, your oxygen tanks, those stretchers, the IV pole. You can find them on a lot of things, especially if they are inside your MRI tech area or MRI work area. So if a patient does need to continue IV fluid medication, especially if they are in the hospital or you work in a hospital as an MRI tech or student, there is an MRI safe IV pole that can go inside the MRI room. You want to just make sure that you are following the proper precaution with disconnecting the battery if you have to remove the battery or the plug to the machine. So each medical facility will have an MRI safe stretcher and wheelchair. So just make sure you're using the correct stretcher. Or if you have a transporter or maybe someone bringing down a patient, make sure they are bringing them down on that MRI safe stretcher or wheelchair. Okay, so now we're going to talk about how accidents are occurring. Accidents are occurring whenever the MRI techs are working too fast. They're not properly screening their patients. They're just looking at the MRI screening form and they see a lot of no's, so they think everything is okay instead of verifying the information with the patient. Sometimes patients do not understand the question. They're going to check no, especially if they have another appointment to get to. So just make sure you are going through the screening form with them again. Using that handheld metal detector device, that is good as well whenever you are scanning the patient, just to make sure they did not forget anything. Sometimes, even if you give a patient hospital scrubs or a hospital gown, you may have let them keep their phone out for a second and maybe they accidentally put it in their pocket instead of locking it back up. So that's another way they can bring an electronic device in. You also have lack of training and education amongst new techs, nurses, or medical personnel. When an MRI tech is too complacent, choosing speed over safety, meaning when techs are trying to clear their work list too quickly. If the tech forgot to lock the MRI door whenever they leave for a second, if they need to use the restroom or if they want to grab lunch, make sure you are locking that MRI door. Bring that key with you. If you work in a hospital where you have to have a badge to get in, still make sure the door is locked. If radiology staff, doctors or nurses, housekeepers, patients, or visitors aren't paying attention to the MRI warning signs, this can cause accidents as well. Here you will see an MRI burn accident from October. You want to make sure that you are checking this out. You can find this information on the Daily Mail website. Just make sure that you can go online and you can just read this article for yourself. I just want to put it here because, like I said, we still are having a lot of MRI accidents, and this one is from October 2023. A way this accident could have been avoided, the tech should have fully screened the inmate and the prison guard in Zone 2. A lot of techs like to screen in Zone 3. I even seen or heard about techs screening patients in Zone 4. So just make sure you are screening your patients in Zone 2. Screen family members in Zone 2 in case they have to go inside the room. This could have avoided this mistake or this accident from occurring. Whenever things like this occur to the patient, it can cause injuries, it can cause burns, it will increase anxiety and claustrophobia fears, it will cause lack of trust in the medical staff, delay imaging and results for medication or treatment, and patient may not ever come back for an MRI scan in the future. So when accidents like this occur, let's talk about how it affects the technologists. The patient will lose trust, the tech will lose their license, the tech will lose their job. So you want to make sure that you are following the safety guidelines and properly screening your patients, properly screening the family members, any medical staff that needs to go inside the room with the patient, even screen your doctors. Maybe they don't know about MRI safety or they don't know how severe it is. So you want to educate everyone. You want to make sure that you know your zones. Knowing and understanding your MRI zones will reduce accidents and errors. There are 4 zones. You have Zone 1, 2, Zone 3, and Zone 4, and we will talk about them in the next slides. For MRI Zone 1, this is the area that patients or the general public can walk through freely. The MRI machine doesn't pose any danger or threat to anyone who is walking in Zone 1. In MRI Zone 2, you have the MRI safety screening being done. No one should not enter this zone without an MRI tech. Verify questions and answers with the patient. MRI Zone 3, this area is restricted by a code or access badge. Only MR personnel and patients have been fully screened or are allowed in this area. The MRI control room is in this zone. Do not screen patients in this zone. Now we have the MRI Zone 4. This is where that scanner is in. All metal objects, electronic devices, and implants are prohibited in this area. You must have been screened properly before entering this zone. Do not screen your patients in this zone. Make sure all of their personal items have been locked away and put away inside MRI Zone 2. The MRI screening zones, you will see most MRI room does require a badge for you to enter in. Most MRI rooms should or do have a key for you to lock and unlock the door. Always remember to lock the door whenever you are stepping away. And put yellow caution tape across the MRI door so that it can let people know, hey, do not cross. For the MRI screening form, you always want to make sure that you are getting the questions answered about surgical histories, injuries, or accidents. You want to make sure that you are checking to see if the patient have diabetes. If they do, ask them if they have that glucose monitor on their arm or their stomach. You also want to make sure they do not have an insulin pump. And you also want to make sure that you are going back through that screening form with them. Have that MRI screening form in multiple languages, and always put remove beside the hearing aids or the glucose monitor that's on the paper. That always make me remind myself that I did ask the patient if they removed it. So I just put remove by that question so that I don't forget or I do not feel scared whenever they are inside the MRI scanner room. Most of MRI screening forms look like this. They may have similar questions. You have your patient's weight you want to get so that you are making sure that you put the correct weight so that the patient does not keep soaring, or you have to keep adjusting the scanner parameters. You also want to make sure that they are answering these questions correctly. Go back through the screening form with them. Sign your name if you are using contrast, or if you're not using contrast. I like to mark out where the contrast amount is. I put a line through that if I am not using contrast, because I do not want anyone to come behind me and they accidentally put contrast on the wrong patient when I didn't give it or when someone else didn't give it. Make sure that you're assigning your name, dating it, and putting the time. Also, make sure the patient has signed their name. Make sure the patient understands that no one should enter the MRI room if they have a watch, hearing aids, metal. So just make sure they understand what they need to remove. This is another accident or incident that occurred back in December of 2023. And like I was saying at the beginning of this presentation, there's going to be a lot of accidents that I may not have in this presentation because a lot keep coming out. But if you just go online to health imaging and maybe you can put MRI accidents or recent MRI accidents, you will see a list of them, so you can just go and read this information about this article. Let's talk about how you can properly screen your patients. So whenever you are screening your patients, make sure you're going back through the MRI questionnaire form with them, screen them visually with a metal detector, make sure they are alert and oriented and can answer those questions correctly. Make sure they understand the instructions. Check the creatinine and GFR if you work at a facility that still check those things. You want to make sure that they are not allergic to contrast if you have to give it. You also want to make sure that they have an implant card if they have an implant. If you have any questions about MRI clearance, make sure that you are checking with the radiologist, especially if the family members who is answering the screening form question with the patient does not know their history. The radiologist may or may not clear the patient to have the MRI scan. If they do, they will order x-rays and maybe of their skull, chest, abdomen, just to make sure they do not have any implants inside of their body. So get with your radiologist or MRSO or even supervisor if you have any questions. Do not be afraid to turn patients away. If they do not have an implant card and they have an implant in their body, you have to think about the patient's safety. Sometimes they do not understand why they are being turned away, and that's because you have to educate them. So do not do the scan. Check with the radiologist, check with the ordering physician, try to obtain an implant card. Sometimes it is scanned into the system, so make sure you are just covering those steps to protect the patient's safety. Make sure you are locking away the patient's item. This is going to promote a safe environment for the patient to feel comfortable, especially whenever they are doing their MRI scan. You do not want them having their MRI scan thinking about if their belongings are safe. So just make sure that you are locking it inside of a locker. Give the patient a key so that they can know where you are putting the key whenever you do get inside the MRI room. And just reassure them that their items are locked away inside of a locker. If the patient does not have an implant card, they will need to reschedule. My saying that I always say, no card, no scan. Check with the radiologist to see if they would like to clear the patient. Most of the time, if the patient has an implant that is an electronic implant with no card, the radiologist will say no. Check with your radiologist on if they can or cannot be cleared to do the MRI scan. Whenever you have the patient positioned and ready to do the MRI scan, make sure that you give them that MRI squeeze ball in case something happens or if they become claustrophobic. This should not happen, but sometimes it does, where the patient forgets something in their pocket and they squeeze that ball, and you have to run in there to make sure everything is okay. So that's why you should be checking your patients for any type of metal or any type of electronic device while you are screening them in zone 2. So now we are going to talk about the causes of burns in MRI, and this is done whenever you are using improper padding devices for the patient. You want to make sure that you are using the padding that comes with the machine or the company who made that machine. Looping the MRI coil wires, you want to make sure that you do not loop any coils or the wires. Medication patches or EKG leads, you want to make sure that that is removed, especially if you work at a hospital or a facility where EKG lead pads have to be placed. Make sure that it is the MRI safe kind if it does need to be placed on the patient. Remember to check the ear. Check behind the ear for medication patches. All the time I've seen patients have them behind the ear. I remove all medication patches. I don't care if it's a nicotine patch. I don't care if it's an anxiety patch. I have the patient remove it because I don't have time to take a chance for the patient to get a burn or look it up to see if the patient can get a burn from it, especially whenever there are other appointments waiting, other patients are on time. They want to have their scan done as well. So I do not want to take any chances on letting a patient go inside the MRI room with the medication patch on. So I have them remove everything that can come off. I check those metallic fibers, the clothing, the steel boots. I have the patients remove it. I always give patients a hospital gown or scrubs to change into. They always tell me, or they always gonna say, the last tech did not have me change. I point to the policy because we have a sign on the patient dressing room door where they have to change, and that is their policy or our policy at the hospital or wherever facility you work at. So instead of arguing with the patient, just let them know it's for their safety, and you can also point to the sign stating why the patient has to remove their clothing. If you follow me on LinkedIn, you may have seen me post this one time, but this is what I point to whenever a patient becomes argumentative and they say, well, the last tech did not have me change. I always point to this sign, or I always tell them to read this sign. This is our policy now, or this is our policy, and we have to get every patient to change. This is what the ACR recommends whenever you have personnel going inside of the room. So you have your non-MRI personnel, which is the patients, visitors, or facility staff who have not undergone formal safety training. You have your level 1 personnel. These will be your office staff and patient aides who have passed the minimum safety education to ensure their own safety as they work within Zone 3. You have level 2 personnel. This is going to be the MRI technologists, the radiologists, the nursing staff who have been trained in MRI safety. This is going to talk about how to prevent burns again. You just want to make sure that you do not loop the core wires, keep them straight. Make sure you provide proper padding that comes with the MRI machine. Place all padding correctly. You want to make sure that you screen patients correctly and get them to change into a hospital clothes or a facility hospital gown or scrubs. So you want to just make sure that they are changing into the proper clothing. So I have a patient that comes down from ICU or from a floor that has to be monitored inside of the hospital. We always have to place the MRI safe leads onto them, hook it up to the machine, make sure a nurse is by just to monitor the patient vital signs. And these are normally kept inside of the MRI cabinet or depending on where your facility has them. So just make sure you are using the correct MRI safe leads. Patient burns can happen in MRI, especially if you are not checking the patient's body, making sure that they are removing those EKG patches, those medication patches. You want to make sure that you are properly screening your patients. and use that handheld detector to just wand them. Don't be afraid to use the wand. That's what it's there for. You can even just check them just to make sure that they did not forget anything on them as well. So just let the patient know, hey, I'm sorry, but I have to look inside your gown just to make sure there wasn't anything placed on you that cannot go inside of this room. If an accident or injury does occur, do not be afraid to speak up. Stop the line if you feel like there is a problem or a concern. If you have a patient who has an implant or a device and they do not have a card, don't be afraid to tell the patient, I'm sorry, you have to reschedule until we can get that implant card. Don't be afraid to call the radiologist because they are very helpful. They do not mind answering your questions. Sometimes if they are dictating, you do have to probably call them a couple of times just to get to them, or you can walk over to their office. But feel free to reach out to them because they will give you the correct answer. They will steer you in the right direction to promote patient safety. Other ways patient safety is promoted and protected is whenever you are wearing gloves, your proper PPE, disinfecting the table, disinfecting the machine, the coils after the patient have used them. You want to make sure that you are getting rid of the sharps properly. Get rid of those needles immediately after you start an IV. Verify the patient correct name, date of birth, MRI exam. Check the creatinine and the GFR if contrast is needed, especially if you work at a facility where you are still checking it. You want to make sure that you are verifying those allergies, especially whenever you are going over the MRI screening form. You can just ask them quickly so that you do not forget. Always provide hearing protection, clear instructions, and give the patient the MRI call ball. Whenever accidents occur in MRI, it affects everyone. It increases anxiety, claustrophobia. It can cause injuries, death, or burns. It causes lack of trust. It decreases the amount of technologists that will likely specialize in MRI due to fear. It limits different types of medical personnel that is willing to come to MRI to clean the tech work area or to monitor their patients. So you just want to make sure that anyone who is entering inside the MRI area that they know everything they need to know about MRI and safety and how far they can go inside of the MRI suite. Maybe they can go inside the MRI tech area but cannot go inside of the MRI room. I know a lot of places the housekeepers cannot go inside of the MRI scanner room. The techs normally go in, they'll take the trash cans out, place them on the outside of the door for the housekeepers, or they may even have like a little mop where they go in and do a clean themselves of the MRI room. This is another article I seen online about MRI accidents raise safety concerns. So you can just read this information. This is from October 2019 that was reported. So you can just follow up on this. And I just inserted this here so that you all can take a look and read this. For screening medical staff for MRI, all medical staff must be screened prior to entering the MRI room. That includes transporters, other MRI techs, CT techs, X-ray techs, doctors, managers, nurses, anyone who have to come inside of the MRI room, especially front desk. Depending on where you work at, if you work in a hospital and let's say it's the late evening and there's not a lot of people in that area, maybe they're on different floors, busy with their own work, you may have to pay someone to come and help you. So you want to make sure that you screen everyone who has to go inside of the MRI room to provide help to you. Here's a copy of how an MRI screening form will look for other employees. It will tell them to fill out this information, yes or no. It will also tell them what needs to be removed. It will have their employee name, employee ID, phone number, department, and their manager's name listed. They must sign their name, and you need to sign it too. And just keep it inside of an MRI binder inside of the MRI tech area. I have another article. This is from October 27, 2023. So I am filming this video in October. So this was close to 1 year ago. You can just take a look at this yourself. You can read up on this article. Just go online and type it in. I just put it here to just let everyone know that within a year, a lot of accidents still occur in MRI. It probably has been about 3 or 4 before I made this video. So just read up on the information. You can also see how you can be a better tech and how you can prevent these accidents from occurring at your own facility. So just take a look at this information online on your own time whenever you feel free to do so. If you work at a facility that wants you to program pacemakers, you want to make sure that you are properly trained, that you know how to program it. If you don't, feel free to speak up. Tell someone you need more time to train, or tell someone that you are not comfortable with programming pacemakers. If you do have to, make sure you have the crash card by, make sure the patient is being monitored, make sure that you program it back into the pacemaker mode. The ways we can make this MRI environment safe, you can test and label the items that will have to go inside of the MRI scanner room or the environment. You want to label them as MRI safe, MRI conditional, or MRI unsafe. Make sure that you are restricting the area and the access to certain population where they have to use a key or a badge to get in. Just make sure that you are providing a personal belonging bins to patients or visitors so that they can put their item in that bin if they do not have a locker to lock it in. And just make sure everyone is being properly educated on patient safety or how far items can go in or outside of the room. You have your MRI safety checklist. This is when you are going to communicate with everyone in the MRI suite, especially if you are getting ready for a biopsy or a case where a patient has to be sedated. You want to make sure that you are performing timeout where everyone introduce themselves. You complete or the patient complete the MRI screening form and you review it with the patient. Make sure all metal objects are removed from the patient and other medical staff. Have the crash cart ready, but outside of the MRI room, and just make sure that everyone know when to go inside the MRI room, what to bring in, what not to bring in. You, as a technologist, need to keep an eye on the staff and the MRI suite and door. Now we are going to talk about teamwork in MRI. This is going to be promoting teamwork to prevent injuries, mistakes, and avoiding staff burnout. Whenever you work together as a team, it promotes a safe working environment, it minimizes mistakes, it minimizes burnout, and the other tech can be on the lookout or can correct another tech. So, for example, if a tech noticed that a patient has hearing aids in, but another tech did not know, you can work together as a team to prevent the patient from getting their hearing aids destroyed or possibly getting a burn while they are inside of the MRI room. So the question is, why are mistakes still occurring? And this is due to lack of training, lack of knowledge, lack of education, misinformation, feeling overworked or burnout, which will happen if you're working too many hours, and high patient volume load. So this is a question you should ask yourself, which is better, more or less? Are you able to get more work done when you're working with more MRI techs or less MRI techs? So if you have more MRI medical staff or medical techs, more work getting done and or less work getting done. Maybe a lot of talking, maybe you have a lot of people, but no one is really working. So let's look at less medical staff. Less work is getting done and or more work is getting done by the technologists. So do you work better by yourself or do you work better with others? To reduce mistakes in MRI, you want to provide more education and training, hire more staff to reduce burnout, attend MRI safe meetings, seminars, and webinars, complete your CEU credits to stay on top of new changes, work together as a team to help eliminate mistakes. So you want to make sure that you are doing this. This can help you promote a safe MRI working environment. So to stay focused, you want to make sure that you are always paying attention. Keep your eyes and your ears on the patient. Keep the MRI speaker up high so that you can hear the patient. Give the patient the MRI panic ball. Do not text or do not sleep. Do not take bathroom breaks in the middle of the scan. Go before you start the patient or go after you end the patient exam. Get plenty of rest the night before so that you do not feel tired and burnt out. Know your limits whenever you are picking up extra hours. For emergencies in MRI, remove the patient from the MRI scanner room as soon as possible. Detach the MRI table from the machine and pull the patient out. Page for a radiology nurse or a doctor. Press the MRI panic button if you have one. Close the MRI door and make sure no one enters the MRI room. And quench the machine if the machine or if the patient is in a life-threatening condition. To increase safety in MRI, give the patient the MRI call ball to avoid them hopping off the table if they are feeling claustrophobic. Update the claustrophobic patient frequently to let them know how much time they have. This reduces the anxiety. Provide proper instruction, education, and training on patients and other coworkers that you work with, because we want to work as a team. We want the patient to understand if they hold still, the exam will be completed in a timely manner. So you just want to make sure that you are also providing an MRI safety wheelchair for patients who are at fall risk. So all of these things you do, it will increase safety in MRI. The key takeaways from this presentation: the MRI machine is a powerful magnet. It produces high quality diagnostic images. Always go through the MRI screening form with the patient. Again, screen your patients in zone 2. Make sure they have changed into a hospital gown, facility gown, or scrubs. Contact the radiologist if you are unsure about an order or an implant. Make sure that patients have their implant card before bringing them inside of zone 3. Never get complacent. For MRI safety training, complete the MRI safety training course to increase your knowledge and understanding. You can also take an MRSO course, complete MRI learning modules that your job sends you, complete your MRI CEUs. You want to train non-MRI personnel regarding MRI safety. Also train MRI students and other potential MRI techs that is looking to cross-train into MRI. Thank you all for watching my presentation. I hope you all enjoyed it. Here are the resources that I got all this information from. So feel free to like, comment, or even subscribe to my channel. Thank you again.